When I was about 14, 15, I started having mental issues, basically depression and PTSD. Luckily for me, the person that noticed was my principal. Yeah? So she talked to my mom, and mom is very supportive. When you go to hospital, you're given an evaluation, or you fill out a form, answer a few questions, and from your response, they can gauge what's wrong with you. I kind of lost touch with treatment. Most of mental patients do. Yeah. So it got worse later, a few years later. So I actually had to go and get hospitalized for a bit. At first I didn't like it. However, as I got better towards the end, the hospital was my, I don't know how to say it, but the place where you'd go to feel okay. But in the beginning, when you're starting treatment, it's normally the worst place. Most people, I remember my friends who were there, or the friends I made in hospital, when they'd come in, they didn't like it at all. But closer to the end, you'd prefer being there than leaving and then having to deal with what you're supposed to deal with. I don't want to, I can't imagine what they're going through, because fortunately for me, my mom was very supportive. She was aware, she was educated, so she I didn't get stigmatized for being ill. I also didn't get it in school. My teachers were understanding, yeah. So I didn't get the stigma bit. However, I can see why most people are not treated for it, because most, I guess in Africa or just in Kenya, most parents will think, say, if you're depressed, especially as a man, they'd be like, man up, or yeah, or if you have proper mental diseases like, say, bipolar or schizophrenia, then they think you bewitched or crazy, whatever, yeah, and then abandon you. Pray for you. I'm not saying prayer doesn't work. I'm just saying that there's some things like, if you have malaria, they'll take you to the hospital and give you medicine and still pray for you. Yeah. So some things, I think most people, most parents, if they're educated, or students right now, if they're educated on it, our young ones, it could really go a long way in helping a lot of people. Yeah. So the people who don't get that opportunity, I bet they're going through hell. Yeah. Because being sick physically is hard. Being sick mentally is the worst. Yeah. Because everyone gets moments of sanity, yeah, where you realize something is wrong. But when you don't get help, fighting yourself, or fighting to be yourself, is the hardest. Yeah, I've seen a few symptoms in people, yeah. But of course, you can walk up and tell them, oh, by the way, I think you have this and this and this. Please go get checked or get help. One, because they look at you like you're crazy. Two, medical care for people with mental illnesses or disorders are expensive. Very expensive. Mental diseases and mental illnesses are very expensive to treat. Yeah. Mostly because it's not really readily available in Kenya. Yeah. You'll find that probably if you ask anyone in Kenya, where do you go to get help for any mental disease, and they'll tell you Madare, yeah, because it's probably the only one they know. If you ask them, if you're sick right now, say you've broken your leg, where would you go? There are thousands of hospitals just in Nairobi. Secondly, I went to a private hospital where there are more options, yeah, especially medically. The medicines that you would get in places like Madare, I bet you 100% you'll find the cheapest medicine which normally has the most side effects. Yeah, and then for me, the most expensive medicine. I remember one pill used to cost about 500 bob. Yeah, and then maybe you have to take 3 of those a day. Yeah, and it's not the only medicine you have. Yeah, so that's 1500 a day. Very few Kenyans would be able to afford that. Yeah. Also, you'll pay for the doctor's fee. You'll pay for bed. You pay for food. Yeah, when you're in hospital, and then you pay for therapy, because normally they'll have group therapy and then your own specific therapy just for you as a patient, yeah, which you also have to pay for, which comes to quite a sum. Yeah. And no one is, well, those who are willing don't have the money, most of them, and those who are not willing will use that as an excuse. Yeah, because they'll say, why are we paying all this when we could be paying for the other school fees or using it for something else. Yeah, so a lot of people don't get help because of that. Yes, actually, one of the things that you get taught during therapy is how to deal with this. You're given steps on how to basically deal with issues that come up. Yeah? I'm not saying I can never get it in the future. That's up to whatever happens in your life. But I have skills to deal with. If something like that happens again, I have skills to deal with it. Mental illness is one of the most ignored subjects in Kenya. Even in school, though I had the support, no one would actually talk about it. Yeah, they wouldn't ask you, "Oh, how are you feeling?" or "Is today a good day, a bad day?" Normally, when you have any other disease, you'll say, "Do you have headaches? Are you in pain?" You know, yeah. So they'd be supportive, but I guess out of lack of education, they didn't know how to support someone with mental illnesses. Yeah. So if you're not okay, then they generally can't help. Yeah. Or they think the only way for you to get help is send you back to hospital. Yeah. So I think there's a lot that needs to be done. A lot. I think the best way to explain mental illness is by asking someone, what has your worst day been like? Your most desperate point, yeah? What has it been like? I'm not talking about when you don't have money. I'm talking about the day when you don't have money. No one will help you and you're wondering what your next step is. What would you like done for you on that day? Yeah. If you know of anything that can be done to you on that day, it's the same thing you should do for that mental patient you know, or someone who's suffering from mental illness. If you think they haven't eaten, give them food. If you can afford to get them therapy, if you can afford to give them something warm to wear, because these things affect their mental health. Yeah, not eating for someone who has depression or any other illness makes them more sick. Yeah, I bet when you're hungry, your mood goes low. Yeah, when you eat, you're happier. Yeah, so the things that you can do that can help, even though you don't have a lot to do or to help someone with. For example, food is very important. Your diet, yeah? Eating properly. Not talking about eating a certain type of food every day. You need your balanced diet every day, 3 meals a day. Yeah. So those things are very important. Just being there for someone is important.
Mental disorders in most studies start by the mid-teens and the mid-20s.
I think if there was a way to educate people, yeah, on mental illnesses, say maybe through a TV show, or maybe like part of the medical training for students is you go to a certain school and keep them aware of, get people aware of the disease here, like the way they do for polio. Everyone knows when the polio vaccine is going on. Yeah? It's mental illness is that serious. Yeah? Mental illness is human.
Mental is human, human too. Oh, next time when you see that sister, when you see that brother, who you call mad, who you call crazy, do you know? Do you understand what they're going through? What they're feeling? 'Cause mental is human, mental is human, mental is human, mental is human, human too. Mental illness is illness like any other, and I need you to show your love, show your kindness, love that family, love those people who you call madmen, who you call psycho. Thank you, humans, who help other humans, but just being human. Thank you, nurses. Thank you, psychiatrists. Thank you, counselors. Thank you, casuals. Thank you, families. Everyone stand up. 'Cause mental is human. 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 Mental is human too.